We are now ready to start. Our colleagues online, we apologize that we had to keep you waiting this long, but now I think is the time for us to really start the symposium officially, and maybe without wasting time, I will ask a volunteer in here or online, if it's possible to lead us in a word of prayer as we open this symposium, the first this year for the Nutrition Society of Uganda, in partnership with the Ministry of Health, the Right to Grow, and other partners here in Uganda and abroad. So, ladies and gentlemen, any volunteer for a word of prayer? Yes, we have Nayevare, I think our colleague from Right to Grow, who will help us with an opening prayer to put this activity in the hands of the Lord, and then we get started. So, colleagues online, an opening prayer.
Let's pray. Lord, we thank you very much for this wonderful day. We thank you for this symposium. We thank you for each and every person that has gathered here and those who are joining us online for this event. We pray that, Lord, you take control of each and everything that is going to take place. Give us great insights. Help us so that we are able to discuss fully and better ideas that are going to help us improve the livelihoods of this country and the development of the country at large. We pray in the mighty name of Jesus Christ our Lord.
Thank you so much, our sister Nayevare from the Right to Grow Secretariat. Ladies and gentlemen, both here and those online, once again we welcome you to this symposium where we discuss a very important subject for development, which is implementation of the International Code of Marketing of Breast Milk Substitutes here in Uganda. For those who may be aware about this code, we call it the famous Blue Book of 1981, and we have some experts who will tell us about it, but clearly it's an international policy framework that was adopted in 1981 by WHO and UNICEF as the leads, but also member states of the United Nations, to ensure that breast milk substitutes are regulated so that we can protect, promote, and safeguard breast milk, which really cannot be substituted according to what they say. And as we know it, it is perhaps the very, we could say complete, or very close to complete food that there is. And we know ably that breast milk is the fundamental right of the child, but also we know that there are very important benefits in breast milk that cannot be equated to any other food there is. So, ladies and gentlemen, this symposium, therefore, is quite fundamental, not only for the development of children, but also for the well-being of mothers and the overall sustainable development of the human capital, as well as of the nations of the world. And we see, therefore, that the world has even come together several times after 1981, notably at Florence in Int'nal, where the Int'nal Declaration was presented in 1990, again to promote and support breastfeeding. We also know, for members who are aware, that even after that, the International Conference on Nutrition, the first of its kind, held in 1992, re-emphasized the issues around the code. And more recently, we know that there has been more emphasis around this through adoption of what we call the baby-friendly initiatives, which include baby-friendly hospital initiative. We also hear about baby-friendly workplace initiatives, but also we hear about or we promote baby-friendly community initiatives. So there's a lot that can be said, but also we're here exactly 1 month after the world came together once again to commemorate the annual Breastfeeding Week. So, ladies and gentlemen, this meeting is perhaps at the right time and addressing the right issue at the right place, since we are right here at the home of the Nutrition Society of Uganda. So that was a big preamble perhaps, but maybe necessary to set the ball rolling. So, ladies and gentlemen, colleagues, allow me therefore to recognize your presence. As we said, we have a big platform here, physically at Makerere, where we are situated, the NSU, but also online, given the COVID-19 pandemic and the regulations around physical meetings and gatherings. So we really thank you that you could be able to dedicate your time for those who have come, but also those online who have dedicated not only their time, but even their data to this noble discussion. So we realized we had to proceed, and as per the agenda, we are hoping that around now, we shall be switching to our Vice President of the Society, Mrs. Florence Tushemereire, who I'm sure she's online. I hope Secretariat is monitoring Florence to be ready. Shortly after that, we shall hear from the Minister of Health, who may also be joining us online. Dr. Gaston is confirming. The Honorable Minister says she may come, so we are on standby. Her keynote will appear as and when she arrives, or she's able to connect with us online. And then after that, we shall be hearing from on the progress of implementation and subsequent topics on the agenda. So, ladies and gentlemen, allow me at this point in time to humbly invite my Vice President of the Society, a lady we have known with many hats, Florence Tushemereire, who is also from the Makerere University School of Public Health. I hope she's online to be able to address her people, since this is an activity of the Society. Tush, over to you. Tush, unmute.
Yes, thank you so much, Dr. Rukundo, and good morning to the participants. I will briefly show my video so you can put a face to a name, and after that I will switch to my presentation, but then I will also switch off the video so I don't get disconnected from the internet. So this is me briefly, and so you can see me briefly here, and I thank you so much. Welcome to the symposium, and I encourage you to participate fully. I hope you have so many questions about the International Code of Breast Milk Substitutes. And let me switch over to the presentation so I don't preempt your expectations. Thank you. I hope we can all see my slides. So once more, my name is Florence Tushemereire. I'm a public health nutritionist, and I work with Makerere University School of Public Health. And as the Vice President of the Nutrition Society of Uganda, I welcome you to the symposium on the implementation of the International Code of Marketing of Breast Milk Substitutes in Uganda. I'll give you a brief background about the Nutrition Society of Uganda, where we started as Uganda Action on Nutrition, and we started in 1999, October 1999, and it was a regional movement in East Africa to increase nutrition visibility. Later, we registered as a corporate body in 2004 with Honorable Janet Kataham Seven as our patron. The society builds on a membership, upon the membership of Uganda, and it is comprised of dedicated, experienced, knowledgeable, and well-trained professionals. Later in the year or in subsequent seminars, we shall give you details of the membership of the society. Our vision is to see Uganda to achieve adequate nutrition for prosperity in Uganda. And also we hope to see the same, we hope to emulate, or we hope to expand this vision to our neighboring countries. And then we promote as a mission, our mission is to promote food and nutrition security for the well-being of all in Uganda. I hope you know there's a difference between food security and nutrition security. You may be food secure, but not nutrition secure. Okay? So we would like to see that as an association, we promote both food and nutrition security for the well-being of people in Uganda. These are our strategic objectives as the Nutrition Society of Uganda. The first one is to provide a platform for collaborative linkages among individuals, institutions, the public and private organizations dealing with nutrition issues. It's a platform where we meet and we share ideas, and also we plan to either to partner or collaborate on different projects or research, depending on your field of work. And then we, as a society, we are open to advising individuals, advising students, for example, the young students or the young graduates, on how to go about implementing their nutrition ideas in the community. We also, our other objective is to regulate nutrition professional development and practices. For this objective, we are open to partnering with different ministries, different stakeholders in nutrition, so that we are able to develop our profession in the country. And then we are also able to regulate what we do. We advocate for strategic actions and policies in nutrition and food security. And today's activity actually falls on objective number 3. Advocacy is one of our key, our strategic objectives in our mandate. And so we are here to advocate for implementing the International Code of Breast Milk Substitutes. The 4th strategic objective is to enhance sharing, learning, and behavior change regarding the value and benefits of adequate nutrition. So wherever we are, wherever nutritionist is, we expect you to enhance, we expect you to share, we expect you to teach people, we expect you to professionally cause social behavior change regarding the value and benefits of adequate nutrition. These are our leaders. The first leader, the founding president, is Dr. Robert Mwadime, and he is the current president, actually. Then from 2004 up to 2006, Dr. William Sali was the president. From 2006 and 2012, as Ambassador, Professor Jessica Kafunda was the president. And from 2012 and 2006, it was Dr. Elizabeth Madra. So from 2006 up to today, we had a transition period, to be frank with you. And then later we formed the Nutrition Society, and Dr. Mwadime is the current president. So why do we talk about the International Code on Breast Milk Substitutes? This code was agreed upon in an international meeting, and we adopted it in 1981. The whole aim is to protect and promote breastfeeding. Uganda's infant and young child feeding policy talks about, or policy guidelines, or encourage exclusive breastfeeding for the first 6 months and complementary feeding from 6 months up to 2 years when the child is stabilizing on our food. So the code intends to protect the mothers and also the children against aggressive breast milk substitutes, marketing of breast milk substitutes. I'm sure some of us have seen these products marketed. Some of them are actually distributed in some health facilities, and some health facilities don't give mothers the right advice, even when the mother is able to breastfeed immediately after giving birth. And some facilities, when the mother is operated on, they don't actually allow them to breastfeed. They just give the child, they market, actually, they give proposals of what to feed the baby when the mother is still recovering from the epidural. But really, we shouldn't be doing that. We should be encouraging, as much as we can, we shouldn't be encouraging mothers to put the baby on the breast within the first hour of birth, especially when the mother is able to breastfeed. So the other aim of this code is to ensure safe and adequate nutrition for infants. So there is no other food that competes with breast milk nutrients, safety. I mean, breast milk is the standard feed, the standard food for infants. So we want to ensure that infants receive safe and adequate nutrition. And in the first 6 months is from exclusive breastfeeding, the mother's breast milk. And then after that, there is adequate complementary feeding, but with also adequate complementary feeding, if I may borrow that combination of words. And then we also want to ensure today, our symposium, the code it wants to ensure that we safely use breast milk substitutes. We shouldn't misuse them. We shouldn't get like on media and start advertising breast milk substitutes. No, but we want to ensure that whoever wants to use them, they use them properly, and also want to ensure that the ministry has control over what is happening in the country. So as a society, this is a role that we play. And today's seminar is one of the activities that we are implementing under our strategic objective number 4. We don't do this alone, but we partner with all stakeholders that are implementing nutrition and health interventions. Today's symposium objectives to create awareness of breast milk substitutes in Uganda at facility level, within the community, in supermarkets, or in other shops as well. Then to sensitize members of the Nutrition Society of Uganda on their roles in the implementation of the breast milk, of the code on the breast milk substitutes within the Ugandan context. To strengthen advocacy and actions towards improved maternal, infant, young child, and adolescent nutrition in the country. To share current policy documents about protecting breastfeeding. So with time, we may talk about a few documents today, but with time, we shall upload the different policy documents that are relevant to each seminar that we shall hold, and so that people can publicly access those documents. So with those few words, I wouldn't want to preempt the next speaker's presentation. With those few words, I really welcome you to today's seminar, and I hope that you enjoy the discussions, and I expect to see active participation as you ask questions where you don't understand, as you propose ideas, and as you share documents that we may not know about. Thank you so much, and over to you, Dr. Rukundo.
Thank you very much. Yes, thank you very much, Tush. Sorry for that background noise, ladies and gentlemen. That was Florence Tushemerere. Maybe the members in the room here, an applause to our Vice President, Florence Tushemerere. Yes, thank you very much. Ladies and gentlemen, that is good progress so far. That was our Vice President, Florence Tushemerere, from the Makerere University School of Public Health. And as I said, we recognize many more people here, both here and online. Currently, I've been told by the Secretary General that around 51 people have joined the discussion so far. We really welcome them. We are live, we are streaming live on YouTube, and I think different other channels, so we are really grateful, SG and the team, for this very candid effort. Ladies and gentlemen, as we have discussed and as we have presented earlier, the meeting is proceeding very well so far. We already have online Madame Samali Namkose, who is the Acting Assistant Commissioner for Nutrition in the Ministry of Health, and we are very grateful the ministry team could be joining us. Madam Samali, before you come in, allow me to inform you that we are gathered here physically at Makerere in the School of Food Technology and Nutrition Bioengineering, which is also the home of the Nutrition Society of Uganda. And today, already now, we have been deliberating on these very important matters of the code. And as you ably know, the code is right under your docket as a sector to ensure that Uganda is compliant to these matters. Here in the room at Makerere, in attendance, we have a team from the UNBS who are very glad could join us. Bwana Hakimu Fumbiro, at least I saw him, one in charge of, I think, standards. I may not have his exact portfolio, but Hakimu Fumbiro is already here with us from the UNBS. We also have members from the academia here at the School of Food Technology and Bioengineering, led by Dr. Gaston Ampek, but also we have Dr. Kajura Richard in the room from, again, Makerere University School of Public Health. I've also seen, and we have indeed, Madame Barbara Nalubanga, who's the country director, IBFAN, if I got it right. We also have colleagues from OPM. I have seen Charles Asimwe. And we also have colleagues from Chambogo University. Dr. Kato Peterson is here, soon to be. We're very glad he joined us. And we also have colleagues from Hunger Project Uganda, Bwana Gerard Kato, I think, and also a colleague from the Right to Growth Secretariat, of course, where Kato is COA. Gerard Kato is COA and the Right to Growth Secretariat. We also have Madame Nayevare, who led us in the opening prayer. We also have Dr. Hedwig, I see, and a number of others in the room, Brian Sekasamba, ambassador in the private sector side, and other colleagues who I may not have their names clearly, but Charles Asimwe from OPM is also ably represented here. So, Madam Samali, I think you can hear the membership. There are many names I have not mentioned, but hopefully we shall get to know them and bring them to your attention. At this point in time, ladies and gentlemen, allow me, therefore, to recognize and invite Madame Samali Namkose, Acting Commissioner, Assistant Commissioner Nutrition, to really communicate to us about the code and what the ministry is doing with this regard as we really have this very important symposium. So, Madame Samali, if you're there, the floor is yours. Kindly talk to your people. Thank you. Thank you.
Samali, please unmute. Please unmute.
Okay, can you hear me?
Yes,
Okay,
please.
thanks.
Thank you.
Yeah, thanks, moderator, Dr. Peter Rukundo, and the rest of the organizers. I should have been here earlier, but I had a meeting where I had to open officially, and it's a nutrition meeting where we are looking at improving the health of Ugandans. But nevertheless, I'm happy that I'm here at least to say a word or two to the members of the nutrition fraternity and public at all. Allow me to stop my video so that my network becomes stronger. So, ladies and gentlemen, all protocol observed, I'm really delighted to be part of this very important symposium, which is aimed at sensitizing the nutrition fraternity about the regulations on marketing of breast milk substitutes, also known as the code. I'm also happy that in this very meeting, we shall be discussing the provision of the code and also highlighting the status of its implementation, monitoring. Thanks to the organizers for ensuring that this meeting happens, because this has been one of our biggest challenges in the promotion of appropriate infant and young child feeding in Uganda. As you are all aware, the regulations on marketing of breast milk substitutes was a theme for this year's World Breastfeeding Campaign. And the essence was really to reinforce our message to the public, to the mothers, about the role that breastfeeding plays in the health and child survival, especially during this COVID pandemic. And ladies and gentlemen, I want to bring you good news that for the mothers who have adhered to the standard operating procedures for COVID-19, their infants actually have been safe from COVID. So again, we want to emphasize the fact that even with this pandemic, breastfeeding should continue, mothers should continue breastfeeding. We all know that breastfeeding is a normal way of providing infants and young children with the nutrients they need for a healthy growth and development. And all mothers can breastfeed anywhere, anytime, provided they have accurate information and support from their families, the healthcare systems, employers, and the society at large. The Ministry of Health is committed to ensuring that every baby in this country is adequately breastfed from birth up to 2 years and beyond. And our policy and implementation guidelines and programs are a demonstration of this. As you are aware, the recently approved maternal, infant, and young child adolescent nutrition, popularly known as MyCAN guidelines, recommend that all mothers should initiate breastfeeding within the first hour of delivery and exclusively breastfeed their infants for the first 6 months of life. We know that adequate, safe, and complementary fed foods should be introduced at 6 months, while these mothers continue breastfeeding up to 2 years and beyond. And we normally also encourage the mothers to breastfeed even up to 4 years. At least I have been able to do it for my own children. Despite the effort members that have been put in place in promoting breastfeeding, there are still other factors that undermine, negatively affect breastfeeding. And one of these is unsupportive workplaces, the policies for working mothers, both in formal and informal sectors, the inadequate support from the healthcare providers in the communities, and also the health facilities are a big barrier to breastfeeding. The other factor, of course, is the inadequate information on appropriate feeding practices, especially to the new young mothers, coupled with unethical marketing of breast milk substitutes in this country. To bring an end to inappropriate marketing of breast milk substitutes, Uganda joined the other WHO member states and has subscribed to the code and domesticated it, and that's why we are calling it the Regulations on Marketing of Breast Milk Substitutes. These regulations aim at making a provision for the safe and adequate nutrition for infants and young children by protecting, supporting, and promoting breastfeeding and ensuring proper use of breast milk substitutes and complementary foods when necessary, based on adequate information and through appropriate marketing and distribution. Ladies and gentlemen, we have these full provisions in the law, in the Food and Drugs Regulation of 1997. And just to inform the meeting here that these regulations are under review because of some of the evidence that is coming on board. For successful implementation, a robust and enforceable legislation should also be at the core of comprehensive response to end inappropriate promotion of foods for older infants and young children. With this said, ladies and gentlemen, this symposium is very timely to educate the public on the provisions of the regulations, and together we can run in the campaign to end inappropriate distribution of breast milk substitutes. As government, we remain committed to join efforts with all the stakeholders and the sectors to ensure that this is achieved. On the program, my task was to officially open this meeting, and I would like to say that with these remarks, I therefore welcome everybody to this symposium and officially open it. I'll be available for any questions, anything that is not clear. I'll be happy to make my contribution. Over to you, moderator.
Thank you very much, Madam Samali, for those very excellent remarks, ladies and gentlemen. Another round of applause for Samali Namkosi. Yes, for those who don't know Samali, we say she's our general in the field because we ably know the Ministry of Health is one of the core sectors advancing the nutrition agenda in this country. And therefore, when you have someone at the highest rank in terms of nutrition, for us in the profession, we ably say that is our general, and we really are happy and glad that you are rallying us forward on this subject. Like Samali has said, Uganda has already domesticated the code. A number of initiatives have been taken, and we already have a statutory instrument, Statutory Regulation 278, under the Food and Drug Act, which is specifically on the breast milk substitutes. But also she has told us that clearly there's work going on to ensure that the regulations are amended, and hopefully, as she said, we shall be hearing from them soon with regard to new amendments to statutory regulation or statutory instrument 278. So, ladies and gentlemen, we thank Samali for that and the Ministry of Health for that leadership on that front, and we look forward to more updates on the processes that are going on with regard to that particular piece of legislation. Ladies and gentlemen, it's now 11 o'clock. We are running out of time. As you can see, we are 30 minutes late, but nonetheless, we are pushing on well. At this point on our agenda was the keynote from the Right Honorable Minister, who's also our patron, Honorable Jane Ruth Acheng, the Minister of Health. We have been told they are in cabinet, so she may join us slightly later through the online system. So Gaston is on standby to keep updating us as and when the minister will be available. Then we can really get her remarks. So we keep optimistic that the patron will address us, and also we shall hear that counsel from her as well as the Honorable Minister in charge of health. There's a team of Secretariat going around to get your details about the introductions, because the Zoom team who's Zooming us live on YouTube had requested that the people in the room be known very clearly so that their pictures can be zoomed in on the system. So he's taking the notes. When they're available, hopefully before the next session, we shall fully introduce you, and we shall request you to stand up when we introduce you so that your picture can be captured for the online Zoom process. So, ladies and gentlemen, allow me now at this point in time, once again, to recognize and invite Mrs. Barbara Nalubanga from the International Baby Friendly Action Network, IBFAN. Barbara Nalubanga has been working previously with the Ministry of Health. Yes, Barbara, thank you very much. And she has been a very strong advocate for issues around nutrition, and specifically issues around breastfeeding. Barbara has also worked in different capacities with different important organizations like the World Food Program, among others, but currently she is the executive director of the IBFAN in Uganda. IBFAN is a global network, like she'll tell us. And today, Barbara, we are very privileged that you're going to share with us on the progress of implementation of the BMS code and regulations in Uganda, not only using your experience as a practitioner in the field, but also as someone who has been in the research around this code and its implementation in Uganda. So, ladies and gentlemen, an applause for Barbara Nalubanga as she comes to address us. So, Barbara, I think you have to use this microphone. I don't know whether it's better for us. Can we zoom this side, or which is better? The other side. Okay, she says it. So Barbara is connecting. I think IT is going to come and share and help us here to get her connected to the platform. IT, just let her connect to the Zoom, come with the code and I think the code and the password, such that she can ably share with us straight away from the platform. I don't know whether, is it? How do we do it? If we had it behind also, it would work. Okay. The code. Okay, ladies and gentlemen, I think we are now ready. Barbara has joined us online as well, although we also had her physically, so that she can share with us in PowerPoint her presentation. So Secretariat host, kindly allow Barbara Narubanga to share. She has just joined the platform. Kindly allow her to share her screen. So is Barbara now able to share her screen? Yes, Barbara is able to share her screen. So colleagues, let's just keep it hanging there. Barbara is about to share her screen right now. Okay, I think, yes. I don't know whether we are okay. We are okay, very good, very good. There comes Barbara. Barbara, over to you.
Thank you, Peter. Social distancing, since you are putting on a mask, am I allowed to? I want to talk with passion when it comes to this subject. I'm Barbara Narubanga, they've already introduced me. Maybe before I make my presentation, I wanted just for people to understand where we come from when it comes to the regulation, violation of the regulation. One thing that we need to let you know, that breastfeeding is nature, and God made it to happen naturally. So as soon as the child is born, the child crawls towards the mother's breast. Ideally, the health worker should put the child on the mother's stomach open, and if they feel the child is feeling cold, then cover the child. When the child's stomach and the mother, the skin to skin, they are together. So this baby moves, crawls towards the what? The nipple. It's like the animal that has just delivered, the cow. You realize the calf moves towards the udder, and no one prevents it. Actually, the farmer, most cases, helps this calf to attach to the udder. But you realize that this is now the child almost reaching what? The nipple. Without help, nature is taking place here. Until the child comes, you can see, he's happy that indeed I'm coming close. And then the child attaches to the nipple. The most important time frame is within the first hour of birth. The moment we miss that opportunity, this reflex, is called rooting reflex, goes, it disappears. And this is where the health workers have a big role to play. What they do, they get this baby, they wrap the baby. You can't imagine holding you candle, how do they call it? Let's see. I'm not sure. So you didn't see the other one?
Yeah, that's.
So okay, this is how it moves. The child is moving towards the breast. The child is at now the nipple. Yes, say yes, I've arrived. And then it attaches. Now we as health workers, we wrap this child. You know when this child is moving, you see the hands are moving. You get it? Here. But because we decide to, that reflex doesn't happen. The child cannot move. This is the freedom of the children we are really working towards. Then, okay, say, okay, if you have taken away my freedom. Okay, where is the nipple? Okay, give me that nipple. Where is it? However, the child has been taken away by the health worker from the mother. The mother cannot even see the child asking for this. The child is crying out, but the mother is nowhere. And why? Our actions as healthcare workers. We take away the right of this child. Sorry, I think the network is on, and if I can connect to this. We take it away. So anyway, this is where we come from. Just take you through the code briefly. Okay, thank you very much, Peter.
IT, they are sharing something. Okay.
So this afternoon, I'm talking about the status of breast milk substitutes in Uganda. The objectives is just to provide up-to-date information on status of implementing and monitoring of the International Code of Marketing of Breast Milk Substitutes and the World Health Assembly resolutions. Specifically, I'm going to present the legal status of the code in Uganda, but probably before I do that, I need to just highlight the provisions and our role as healthcare workers, and also provides an insight into some of the violations taking place in the country, briefly. So we all know manufacturers promote their products and try to persuade people to buy more of them. Even our manufacturers of breast milk substitutes promote their products to persuade mothers, parents, caregivers to buy them. Promotion undermines the confidence of mothers in their ability to breastfeed. The confidence of mothers just disappears. Breastfeeding must be protected from the effect. The promotion of breast milk substitutes. Just imagine all these people are going to the health facilities to promote. So and so this manufacturer has gone, this distributor has gone, they are all around the health facility. So what happens? So individual health facilities and health workers can also protect breastfeeding. How can they do it? To refuse or allow companies to use them to promote breast milk substitutes. Actually, companies, I'm not against anyone, I'm against the practice. So when I talk, It's about the practice. So we have a role as healthcare workers. So here, what are we talking, what do we mean by implementation? Implementation means translating the International Code on Marketing of Breast Milk Substitutes into our national legislation or regulations. Then enactment and enforcement of a robust national legal framework or measures is very essential, given what I've shown you. The kids need to be protected. The babies we need to protect their rights. So this ensures that parents and other caregivers are protected from inappropriate and misleading information. Everyone has talked about the code, how it started. In Uganda, we have the regulations on marketing of infant and young child food 1997, and we just let people know we do not refuse the sale of these products. The issue is the marketing practices that we are looking at. And do not misquote when it's a Barbara's refuse. No, it's about the marketing and promotion of these products to the mothers and their families. So what are we talking about? What are those products that are included in the code? There's infant formula. We have other milks and foods and beverages, including bottle-fed complementary foods, therapeutic milks, follow-up formulas, and growing-up milks. These days we have growing-up milks. Initially, it was follow-up formula from 6 to 2 years. Now growing-up milks and are now the in thing from 2 to 3 years. So it's more of the marketing practice that they look at these milks, but they are almost the same. The nutrition composition is almost the same. We also look at cereals. We look at jarred foods, infant teas, juices, and bottled water, as well as feeding bottles and teats. So all these are within the regulations, and our regulations look at 0 to 3 years. Nothing should be promoted between 0 to 3 years. And those are our provisions, which I'm going to go through one by one. Especially advertising. There's no advertising in the general public. No free sample supplies to the health facility. No promotion of products in or through healthcare facilities. Mother care workers, they are called mother craft workers, but they are basically marketing personnel, should not be in contact with mothers at all. There should be no gifts or personal samples to mothers. Labels, the good thing UNBS is here, should be in appropriate language and have no words or pictures idealizing artificial feeding. Only scientific and factual information to be given to health workers. I believe Gaston is going to build on that. Okay. Government should ensure objective and consistent information is provided on infant and young child feeding. All information on artificial feeding, including labels, should explain the benefits of breastfeeding and warn of the costs and hazards associated with artificial feeding. Healthcare workers and health systems should comply with the code. So I'm starting off with advertisement. In the general public, no advertising or other form of promotion at the point of sale or giving samples or promotional device to induce sales directly to consumer at the retail level. Even in the supermarket, they are not supposed to advertise or promote their products. We have seen where they have decorated the front part, you know, as you're entering a supermarket, they have decorated the front part beautifully. Okay, you've decorated, that is it, but don't talk for that shelf. Let the shelf talk for itself. That's what we mean. In situation where we go and ask mothers whether any marketing person has contacted her and they tell us probably so and so, such and such a company contacted us, then we shall record it as a violation, because these mothers talk. The other issue that is coming out is cross-promotion. Cross-promotion is the way you see these packs. You have here infant formula 0 to 6. This one is 0 to 2 years. This one is 2 to 3 years. But they have the same pack. This is what is called cross-promotion. Ideally, each of these packs should look differently, but it's more of a matter of confusing mothers. A mother will just go and pick a pack, whether it's for 2 years and to feed a child who's what? Below 6 months. This is not allowed in the regulations. Free samples. No free samples. Free or low-cost supplies or donations, or including donations. Product samples should not be given to pregnant women or mothers. And free or low-cost supplies of product are not allowed in any part of the healthcare system. Be it they are telling you, no, we are giving you at 70% infant formula, it's not allowed. The facility should purchase this through the procurement system, and it's well documented. And that's what it talks about here. Promotion in health facilities should not be, the health facilities should not be used to promote products, nor should they be used for product displays or placards or posters. There should be no posters in the health facilities concerning the product or brand name. Here is an example. As I was preparing for this session, because as IBFAN we consult each other, one of the person indicated that these things, this is cow and gate. This, it's a sticker. It was on the door of the clinical room. And then the wards, they have a sticker of cow and gate. Really? A mother is going to consult, and the first thing she cow and gate. Then why should I breastfeed if I have something that is here that I can feed on my baby? Yeah? And then these are brochures and a notebook given to the health worker. The health worker even didn't know. She was busy writing notes in a what? A notebook. But that is a violation. So what is the role of the health system? You should not promote products under the scope of the code, nor allow companies that market foods for infant and young children or feeding bottles and teats to use the health system for promotion. We are being used, guys, we are being used as health workers, and we cannot tolerate this. And I'm going to show you how are we being used. We talked about the procurement. So in case a health facility needs formula, there are mothers really who cannot read, breastfeed. Give it to the mothers who need it and show them how to prepare it. And there should be no conflict of interest. Health facility may accept supplies of products under the scope free of charge or at low cost, but this one has to be documented. They may not, accept, they may not, but we are putting may not. There are situations where they may. Please consult. Consult. And we have now programs that are being run by the food industry. They are the ones giving nutrition education in health facilities. Up to yesterday, we have just been training in charges of health facilities, and now they are telling us it is happening. What happens, they come and give you tins of formula, you put it under there. As a mother, you judge and say this mother can buy formula. And so you go and tell, Mama, there is formula here. Because remember, there is a kickback. There's a commission on that formula. They were really disappointed that they were being used up to that extent as health workers because they didn't know. So as much as possible, these people should not even be giving nutrition education in the health facility. So what do we look for in a health facility? We look at free supplies. We look at company materials. We look at gifts. We have some of you people are saying that these notebooks are beautiful. The pens, we have never seen these pens. We can take them. But whatever pen you take, that's a life of a child. Just imagine this is your child that is being candleyard. This is your child that is struggling, crying out, "Mommy, help me, I need my right." But you are not there as a mother. You are not there to give this child what it deserves. This is what really disappoints me at times. I'm wondering, my lovely son failing to get the milk that God has given him, and you give him second class, and yet you can feed, you can breastfeed as a mother. You can be supported to initiate breastfeeding. Moms, there's no better gift you can give your children than breast milk. That skin to skin is the first bonding. No one will ever give you that love. No one. It's only your children. Why do you sell it off as a mother? And health workers, we are doing this thing as a ministry. God put you there for a reason, to promote his natural way of doing things. And unfortunately, at that day, he will ask you, the talents I gave you, what did you use them for? I was selfish because I needed money to feed your baby by destroying somebody else's child. Some health workers do it, they don't know, while others do it, they know. All they want is money to build a mansion on the lives of children. I'm not attacking anyone, but I'm attacking the practice, please. So promotion to health workers, we have told you, information provided to health professionals by companies should be restricted to scientific and factual matters, and this information should not reach the mothers. They are telling you there are mothers who have challenges, preterm babies. Yes, there are some preterm babies which are failing even to mother to get breast milk because she's stressed. So those are the ones you not get funds from these people. Please, because the moment they give you funds, because the moment they take you for this meeting, you can't tell them no. You cannot tell them no. And even by the on the other side, I'm one person who is so much into the word. Maybe when you grow older, you know the word. They tell us, do not, when you see the enemy, run. I'm not telling them that the enemy, the practice is an enemy. Run. Run. Don't even stay. Otherwise, you'll be compromised. So our role as health workers, we have the responsibility to encourage and protect breastfeeding. We need to prevent conflict of interest. We should not receive financial or material inducements from company. Nutrition Society, we are health workers, believe me or not, in one way or another. That's why I'm saying health workers are both in public and private. Don't say because I'm in private, I can do whatever I want. All these are God's children. wherever you meet them. This is your ministry. So when we come to monitor health workers, we look at the information materials that they have been given, we look at the free samples that you've been given, we look out for financial or material inducement, and then sponsorship. If sponsorship is to be done, let it go through Ministry of Health. It's Ministry of Health to know who should go. They should not target Barbara, you go for the training. So and so go for, let it come to Ministry of Health in that basket, and it's Ministry of Health. And Ministry of Health will not even say it's Nestle or it's so and so to who gave. No, they will say, okay, you go for that meeting. But also Ministry of Health has to judge which kind of meeting you are going for as a health worker. Somebody has talked about COVID, I will not talk about it. Even with HIV, God has protected his children through exclusive breastfeeding. The children who are getting HIV through exclusive breastfeeding, the number is minimal because it's God. COVID-19, you've had. I have not heard of a child who has got COVID-19 through breastfeeding. And that is God protecting his kids. If you cannot protect his children, he will do it for himself. Gifts to mothers or health workers. That's this one, I've talked about it. Even research, you have to declare conflict of interest in that research. Because now we have gone into giving health workers money to do research in the area of infant and young child feeding. So this one is just building on what you are supposed to do. The presentation is going to, I'm leaving it behind, and then you'll still go further into it. Information and education materials should include clear and consistent information on benefits and superiority of breastfeeding. Indeed, breastfeeding is superior. I have done it. I have seen. I'm blessed. It works. Maternal nutrition and the preparation for and maintenance of breastfeeding. Negative effect of breastfeeding negative effect on breastfeeding of introducing partial bottle feeding, difficulty of reversing the decision not to breastfeed, and where needed, proper use of infant formula. And also if a mother decides not to breastfeed and give infant formula, please look out for the tell her about the social and financial implication of its use, the health hazard of inappropriate foods and feeding methods, and the health hazard of unnecessary or improper use. So tell her, and for her to take a decision. It should be an informed decision, and she goes with it. Because that will be between her and her child, her and her God, and it should not be a barrier, a facilitator. There should be no picture idolizing, actually there should be no picture idolizing artificial feeding. This, what we've seen in Uganda, international guys, if you look at them, Nestle, whatever, where they are, the teens do not have a smiling baby or a baby. They don't have those pictures which induce mothers look and say, I want my baby to be like that one. But we have our problem of our own food companies. They have beautiful babies on those packs. That is a violation. And actually, Hakim is here. Hakim, they put UNBA stamp. Boom. I said, but what happened to Hakim? Where was he when these things were happening? We shall talk. So that's where we need now to work on. Institutions must avoid conflict of interest. That one I've mentioned it. Labeling. Labeling is a disaster in Uganda. Sorry to mention, when it comes to our own products. There's no age. There is no, the actual importance of breastfeeding is not put on even those complementary foods. There are pictures, there are nutrition claims. The other day I was with somebody who was telling, they have a multivite. It provides all the protection the child needs for the first 6 months of life. I said, guys, this is a health claim. The person went into arguing. I said, you know what? Let it be. That is a claim. If breastfeeding also has that little whatever it is, it will reduce the risk by breastfeeding. There's some risk of infection Who are you to say that all the protection is in that one food? So that's what they talk about here. And also it's important for mothers to know that this formula is not 100% sterile. It has microorganisms. So the preparation is like you put the powder in the container and add hot water. It's not cool water, but hot water to kill those microorganisms. The mothers have to know about it. And after feeding, you should pour it because now you've killed the nutrients, anything that can protect it. So as far as we are concerned, WHO assessed our regulations. And our regulations are lacking on the scope. We have not included the gum. This is what somebody was talking of, the growing up milks. It is not part of our regulations. There are also other areas that we need to work on our regulations as far as the scope is concerned. Monitoring and enforcement, they are good to go. The 1997, you can't run away. The moment you are got, the law can take you up. Information and education material is still a challenge. You can see we are supposed to be at 10, but we are 6. Promotion in general public, our regulations are 100%. Promotion in health facility, we are covered, that's okay. Engagement with health workers, our regulations are doing well. The problem is that we are not enforcing them. UNBS labeling is where our problem is, you can see. That's where we have red. We need to improve on our labeling, and as somebody said, as in the process of revising UNBS, we need to be with you to fill up that gap. It's really big. So as far as the implementation of the code is concerned, this one slide says it all. So there are people who are talking about complementary foods. Complementary foods are also within our regulations. Yeah, where promotion of foods for infants and young children is not prohibited, but for us we prohibit it. Messages used to promote such foods should support optimal breastfeeding. And such messages should include statement on the importance of continued breastfeeding up to 2 years, somebody has mentioned it, and beyond, and the importance of not introducing complementary feeding below 6 months. This is where I had issues with the people who were promoting some of the complementary foods. They are going to health facilities to meet pregnant women to start promoting these complementary foods. No, even mothers who have just delivered. This one should be out of the health facilities, meet the mothers in the community. But still, the strategy of promotion is not allowed. Food safety, we have challenges. The nutritional supplements should not replace or undermine support for sustainable practice of exclusive breastfeeding and optimal complementary food feeding. I'm yet to be corrected whether we have national guidelines on safe preparation, storage, and handling of powdered infant formula, because FAO and WHO have those ones. I don't know whether we have adapted them in our policy. So, what is the role of health professionals? I'm almost there. We have the responsibility to monitor the application of the code and to draw the attention of manufacturers and distributors to the code violation. This code applies to us as the Nutrition Society. I'm also a member. And also the global strategy of infant and young child feeding states that health professional bodies should observe in their entirety their responsibility under the code and national measures. Conflict of interest. Conflict of interest is something that is really killing us. It's not only infant feeding or breast milk substitutes, but most of our activities, especially nutrition. So, as much as possible, health professionals have specialized knowledge and hold the trust of their patients. We hold the trust of these mothers. We hold the trust of this baby. They trust us. But our interests, we are looking beyond them to get something from these infant food manufacturers. That's what it's meaning, what? Conflict of if you are really a profession, ethically, you should look beyond yourself and the third party, but look at this mother you are serving. But most of us are now looking beyond the mother and also looking at ourselves and our children. This is a problem. So we must avoid conflict of interest. This is what is killing us. Even the people who are producing these products, it's about them. Even as nutritionists, we have our own products. You think we are thinking of mothers? No, the first thing is about ourselves. Where do we benefit from? So as infant food manufacturers, they have the role to monitor their marketing practices. It's not about us to do it for them. They know the code. They know the regulations. They know they exist. So they need to monitor their practices. And so companies should comply fully with their responsibilities under the regulations. So this is a message I just want to leave behind. I'm talking to people who are producing these formulas. Infant formula manufacturers have a duty to their stakeholders, not our mothers, to maximize sales of their products, which by definition means minimizing exposure of infants to breast milk. By breast milk going down, they are maximizing. Hence, while publicly stating their commitment to breastfeeding, infant formula companies are in fact profiting from the failure of breastfeeding. And in some countries, they are the ones telling these people to wrap, the health workers to wrap the children. They have taken over the health facilities. Or even failing the health workers to do what it's supposed to do. So you can imagine, these are all violations. This is equipment in a health facility. These are products that have their names and what we have just been talking about. And these are the health claims about their products being better. But I just wanted to show this one. These are doctors who went for a meeting in Egypt. Little did they know that Nestle was taking their photo and putting it on a website. By the time they entered back to their country, everybody was like, you have let us down. You have let us down, because it immediately went public. That's the same thing with us nutritionists. The moment you go to that plane and come back, you have let us down. Thank you very much.
Thank you very much, Barbara. Ladies and gentlemen, another applause to Barbara Nalubanga. Yes, Barbara, thank you very much. This was really, I would say, a touching, chilling would be a difficult one, but really a touching presentation, which really has reached our hearts internally. And I think many of us are reflecting on really the issues you have raised. Clearly, ladies and gentlemen, colleagues online, everybody following this symposium, you may agree with me that Barbara has set the stage. She has really told us the core principles around the code, but also underscored the challenges and omissions on our part, not only as professionals, but as a nation, Uganda, having the fact that a number of challenges are still apparent. She has shown us that health workers have outrightly rebelled against the code, and she's rallying us to come back home to the right place of the profession, to be able to promote what is regarded as the natural way of doing things. And she ended by telling us the conflict of interest around this issue, and the fact that we have really thrown away the ethics of our profession, and also other health workers have you, maybe due to lack of awareness, also fallen short on their responsibilities. So clearly, Barbara, it's touching. You have challenged us. We thank you very much for being there. Not many can be bold to say what you have said, but I think you have really thrown the ball in our court. And you have also challenged UNBS to stand to the occasion, to the fact that a number of players have bypassed the rules, and therefore the child has suffered this consequence. So clearly we are thankful, we are grateful, and we hope we shall continue engaging. I'm sure we have a plenary around a few minutes from now, but allow us, ladies and gentlemen, to allow Barbara take her seat with another applause. Thank you very much, Barbara. Ladies and gentlemen, that was the interesting one, which has laid the ground, progress. And from Barbara's presentation and the slide we saw, there are a number of challenges we can talk about. The Ministry of Health, hopefully Samali and team have had. There's a lot of work to be done in this area. But also, how do we make it a win-win so that we do whatever we do responsibly without the conflict of interest that has been alluded to. So it's really a challenge, ladies and gentlemen. At this point in time, as we reflect on Barbara's presentation and we prepare for the presentation of our very senior colleague, Dr. Elizabeth Chiboneka, the Zoom team had asked me to officially recognize the members in this room so that they can be focused on. And I think the Kankere University School of Public Health is Dr. Richard Kajura. An applause, members. Yes. Also with us here from Makerere again is Gerard Tumwine from this department. Gerard, yes. Also with us in this room is Miss Abika Angela, also a member from the Makerere University School of Food Technology and Nutrition. Thank you. Also with us, ladies and gentlemen, is Shaidat Nasaku from UBC. Shaidat, I think that's the member of the media. Stand up for recognition, Shaidat. Yes. Shaidat will be giving us some media updates, and that's great. We also have from the media, Barbara Namialo. We can recognize you, Barbara. You can stand up for Zoom, YouTube to recognize you, please. We also have Siraj Akutekereza from Baba TV. Yes, Baba TV representative is also here with us. We also have Robin Anantale from Bukede, who's also here with us. Muhammad Wamala Salt TV, here with, I think they've just gone out, and colleagues. We have Dr. Hedwig Acham from the school as well. Dr. Hedwig, thank you very much. We have also Promise Tumineke from Daily Monitor. We also have Edward Kaiwa, I think from the New Vision. But also with us, members, is George Bulime from the Nutrition Society of Uganda. Yes, also working with the private sector. George, thank you. We also have Violet Nabatanzi, the name here. We had, yes, with the respect, Charles Asimwe from the Office of the Prime Minister with us here. Thank you very much, Charles. I had already talked about Brian Sekasamba also from the private sector here with us today. Also we have soon to be Dr. Kato Peterson Chikomeko with us here from performer in the area of pediatric and nutrition, as well as pediatrics itself. She has been a former director or manager at the Mwanamjimu Nutrition Unit here in Kampala, the center that has really produced and continues to produce very important milestones and graduates, as well as support implementation of nutrition in this country. Dr. Chiboneka has also been a consultant on nutrition, and specifically child health and nutrition, on a number of studies, a number of projects, and even at the Ministry of Health as an expert in that field. For many of us who have worked with Dr. Elizabeth Chiboneka, we know her warm heart, very receptive, always welcoming, but always also eager to contribute to learning and human capacity development in the area of human nutrition. At this point, ladies and gentlemen, with an applause, Dr. Elizabeth Chiboneka.
Yes, thank you, members on call. Good morning, everybody. It's almost mid-morning, and I hope you can hear me well. I would like to ask Dr. Gaston to share the slides. I have a few slides to present. Dr. Peter, can you hear me? Dr. Peter, can you hear me?
Well, Dr. Elizabeth. Sorry, Dr. Elizabeth, there was an echo. Sorry. Okay.
You can go ahead.
Okay. I wanted Dr. Gaston to share the few slides because I'm on phone. I want to talk about the implementation of the code in the hospital. First of all, we know that first of all, we know that breast milk is the global standard for optimal nutrition and health. And we're also aware that breastfeeding promotion is a key newborn and child survival intervention. Right now, more than 800 children worldwide are dying because of suboptimal breastfeeding. And there are multiple causes of suboptimal breastfeeding, including the marketing of breast milk substitutes. The code has been talked about. Summary has ably talked about the International Code of Marketing of Breast Milk Substitutes. And all obvious like infant formula, milk, teas, cereals, and so on, including the feeding bottles and tips. And she has also ably explained the ban on activities which are designed to persuade people to use breast milk activity substitutes or to influence their choices. Things like advertising, including posters in health facilities. She has mentioned giving free breast milk substitutes to mothers and health workers, as well as giving free gifts of any sort to health workers and mothers. She also mentioned giving free or any supplies of formula to health facilities or mothers or even staff. So we are looking at breast milk substitutes of food being marketed or otherwise presented either as partial or total replacement for breast milk, whether or not they are suitable for that purpose. Of course, I've been in the health facilities for quite a long time, and we've seen a lot of challenges. Maybe we can look at how health workers can protect mothers and families from marketing breast milk substitutes. I know a lot needs to be done, but maybe what we need to see now, what are those simple things that we can do which can help the health workers to protect the mothers, families from marketing the breast milk substitutes. The staff of facilities who are providing maternity and newborn services, as Barbara has said, one, they should not promote infant formula, feeding, bottles or teats, and so on. And they should not engage in any form of promotion or permit the display of any type of or advertising of breast milk substitutes. These staff should also not display or distribute any equipment or materials which may be bearing a brand name of the manufacturer of breast milk substitutes. They should not give out samples of infant formula to mothers to use in the facility or take home. Although we know that sometimes they sneak into the health facilities and they talk to individually and privately to the health workers. Barbara has also clearly mentioned about avoiding conflicts of interest with companies which market foods for infants and young children. This one is true, but we know as health facilities, there are many challenges with our health workers, a conflict of interest. One other thing is many times we find the companies supporting CMEs. CMEs or either continuous medical education or continuous nutrition education, whatever it could be. The CMEs in there, they are not bad, but if they are sponsored with a hidden agenda, that's what we are talking about. They are usually sponsored manufacturers or distributors of these breast milk substitutes. So when we are looking at the health workers, where all maternity services are provided or newborn services are provided, there are certain simple things that they can do so that they do not promote, or they are not faced with promoting the breast milk substitutes marketing. One is to carry out breastfeeding counseling for pregnant women and breastfeeding mothers. I know this one is done in antenatal, but probably it's not sufficient. Some mothers come once or twice or 3 times, and they may not come the 8 times that is required. So sometimes they do not get the adequate information which they need for themselves to make the adequate, to make the decision for breastfeeding. They should adhere to the regulations on marketing of infant and young child foods, but they cannot adhere to this unless they know what the regulations are. Regulations of the regulation of the infant health facility. I know I've been in facilities where health workers don't even know how to look out for these violations. But I'm glad that now that we are being sensitized, especially the nutritionists we are creating awareness this morning and this afternoon. Maybe now they will be aware of these violations of the regulations in marketing of infant and young child foods in the health facility. Many nutritionists are not attached to health facilities. Some are working elsewhere. Some are even working with manufacturing companies. But when those ones, especially who are working in health facilities, they need to be clear and they should know what the violations are, now that Barbara has gone through them. The other thing that health workers can do is to provide appropriate community referrals and linkages to ensure that mothers and babies access a continuum of care. This is a two-way. Those coming from the community to the health facility, and then after discharge, because we know that a big percentage of our mothers actually deliver in the health facility. They deliver in the health facility, but there is also a group which delivers in the community. So there should be that coordination wherever a nutritionist is to see what is appropriate and how to link these mother babies for community support within when they go back after delivery, because really that's we have a gap in that area, that a mother can get the information in the health facility, she can initiate within the first 1 hour, but then when she goes back to the facility, then she's confused. She's confused because of other practices within the community. Health workers should also carry out breastfeeding counseling and support for pregnant and breastfeeding mothers with COVID-19 infections, HIV, and so on, to ensure maintenance of optimal breastfeeding practices. I know now we are living in the new normal where we have COVID around, but we have to work around COVID. The next slide shows the effects of marketing. Can you project the next slide? It shows the effects of marketing breast milk substitutes on infant feeding practice. On the left, you have the breast milk substitute marketing, and it shows like the weakness in the code, the lack of regulations, limited enforcement, so on. Diversification, breast milk products, whatever they are, they have already been described by Barbara: the infant formula, follow-up formula, the toddler milks. And then the other issue is on suboptimal delivery, postpartum health facility practices, and also the free breast milk substitute samples, supplies, and the advice to use the formula. So all those are challenges, and they are going to affect the marketing of breast milk substitutes in infant feeding practices. So we also have attitudes which favor benefits of breastfeeding. We have confidence in the ability of the mother to breastfeed optimally. When they are breast milk substitutes marketing, the mother may end up by not getting that confidence to breastfeed her baby optimally. And then we also have social norms which may favor breastfeeding. We are going to discuss all these in the next slide. So what the effect of marketing breast milk substitutes is going to have on infant feeding practices? We are going to end up with suboptimal breastfeeding practices because of this marketing, which is lingering around the health facility. But we also know that there are other factors. Next slide. There are factors that may influence infant feeding decisions in addition to breast milk marketing. There are other factors. It's not only the breast milk marketing that may influence the infant feeding options. We want our mother to initiate, somebody said, within the first 1 hour, exclusively breastfeed 6 months, and then continue breastfeeding for the next 2 years or beyond. That is the optimal breastfeeding practice. So, what are these other factors? There are hospital policies and practices that separate the mother and the baby. We see this a lot, especially in private practice. A mother delivers and the baby is taken away from her. She's either put in a newborn care room, or the baby is put in a special place to allow the mother to rest. These policies and practices, they are going to influence the infant feeding option. And they are facilities who even tell the mothers to come with infant formula when they are coming to deliver. So this is going to influence. I know it's not marketing, but it's going to influence, and the baby is not going to get optimal breastfeeding. The inadequate counseling, which we've talked about, and support on importance of breastfeeding during antenatal, during the time of delivery, and it's also going to affect the infant feeding decision. So if a mother sees infant formula around and she's being talked to, and the health worker don't know what to do, then she'll end up by using the other milks, or infant formula, or any other milk. It could even be animal milk. The maternal lack of confidence to breastfeed optimally. When a mother sees infant formula with a nice looking baby, her confidence may go away, and she may think that this, maybe the infant formula is the best to do.
Ladies and gentlemen, we seem to have lost Dr. Elizabeth. I think the connectivity.
And one
Sound well. I don't know whether it's we who lost the network, or whether it is the other side. Okay, Dr. Elizabeth, sorry we somehow lost you. That's why we are back to the command center. Ladies and gentlemen, sorry for that. We lost Dr. Elizabeth Chiboneka along the way. It's apologies from here at the Secretariat. I think it was a connection challenge, but she was underpinning the point that really breastfeeding is core for the child's development. She has shown us from an experienced point of view the challenges health workers are facing on a day-to-day basis with regard to ensuring that the lives under their care are kept okay. And we are told Dr. Elizabeth is back. So
sorry, I think I got muted. Eh? Why? Since we've run out of time, it is important that health workers should counsel and support all pregnant women on breastfeeding and mothers of children less than 3 years, as we've been told that the period is 3 years to initiate breastfeeding within the first hour of life and to exclusively breastfeed the infant for the first 6 months of life, and also continue for 2 years, 2 to 3 years. And mothers and families must be protected from the effect of marketing breast milk substitutes using the provisions of the National Regulation of Marketing of Infant and Young Child Foods. And the healthcare providers, they have a very key role, including nutritionists, to play in order to protect families from the effects of marketing of breast milk substitutes. Thank you.
Applause for Dr. Elizabeth. Doctor, we thank you very much for being resilient, even when there are challenges of IT and internet connectivity. The sound didn't come clear at the end, but thank God. And thanks to your resilience, we're able to get you loud and clear, and you are able to complete your point. So, ladies, we shall keep moving with you on this journey of ensuring that Uganda has a country, has a population that is adequately nourished, but importantly, that our children, if adequately optimally breastfed, and they have a good nutrition status. So, ladies and gentlemen, we are now coming to the tail end of our symposium, and we shall end it with, before the final remarks, with a panel discussion shortly. And allow me at this juncture to invite 4 members who will give us a panel engagement or remarks regarding what they have gotten from the discussions today. Allow me to invite, at least from the UNBS side, Mr. Akim Mufumbiro to the high table here. Akim, already there are issues which have emerged, so we hope to gain some insights from your experience in the Bureau on how best we can address some of the issues Barbara raised. Of course, with honor, Barbara will be coming back at the podium as well for that panel to share with us any questions which may emerge from her very powerful presentation. Ladies and gentlemen, I will also invite a representative from the academia, and in this case, we are going with Dr. Kajura Richard from the Makerere University School of Public Health. So, Dr. Richard, I kindly invite you to come forward, at least to represent that perspective from the field of research and academia. And also, ladies and gentlemen, from civil society, allow me to invite Bwana Gerard Kato from the Right to Grow, and I think the Hunger Project Uganda, to also give us some brief insights on the Right to Grow initiative as partners in this discussion of breastfeeding. Apologies, we had thought we would also get perspectives from the private sector, but it was a challenge given issues of the code. So we really strongly apologize for that. So colleagues, yes, Gerard, sorry. You're really welcome. Sorry, the distancing, I'll stay here at the top so that we are ably socially distanced. So, ladies and gentlemen, allow us go into a brief panel discussion around this subject and specifically get some highlights on how best we could proceed given the wealth of information that we have so far received this morning. And allow me to start perhaps from the side of government, UNBS, and Hakim, apologies that I have to start with you, but clearly Hakim, and I know we have been in this game together for a long time, but Barbara made some very powerful points, and perhaps, I don't know whether they were allegations, I've called them points. So they are very important points, and clearly she pointed to the fact that there are some challenges in our enforcement of the quality standards, perhaps not around manufacturing, but around labeling of the products that are available on our market. So I wanted you to put that in perspective, and perhaps from the point of UNBS, how are you perceiving this issue? And what measures are in place perhaps to ensure that those aspects of the code are taken care of at that level? Thank you, Hakim.
Yes, thank you very much for this opportunity to address this symposium, very key and important. Straight to the point, UNBS's intervention in this particular space starts from our core mandate as an institution, and our mandate requires that one, we develop standards, which we have actually already done for either infant formula or follow-up formula or products that cereal-based products that for infants and young children. We have done this not only in Uganda, but harmonize them in the East African region, and to specifically indicate that these standards are heavily based on the Codex equivalent standards of the same products, and to also further emphasize that actually most of the standards that are developed within the Codex system are heavily influenced by the code itself that we've actually talked about today, because the Codex is really FAO and WHO. So if you look at the current standard we have, for example, for infant formula, all the elements inbuilt there for labeling that my colleague Barbara was highlighting are actually already embedded in the current Uganda standards. So from the development side, I think we are very good. We have done our part in terms of consulting, engaging all the stakeholders within this sector to establish standards that respond to the current requirements, current needs in the marketplace, and we keep doing that to ensure that standards remain abreast with the current developments and technologies. Once we have developed the standards, the next approach for UNBS now tends to go into the enforcement side. Many bureaus of standards in the world are not structured the way UNBS is done. Actually, some of them are now moving away from development and regulation, but we are still in that space, because we develop and then enforce at the same time. So we go into the enforcement of the specific standards that have been developed, and to also emphasize that we do not enforce unless there's an existing Uganda standard. That should be very critical for everyone to understand. So if we don't have a Uganda standard, it's not possible for us to enforce. But the sector that we're talking about today already has a wealth of existing Ugandan and regional standards, as I've already indicated. The enforcement is twofold. One, at the national level, where we now require, through the distinctive mark regulation, that no product can be produced and marketed in Uganda unless it has been certified by Uganda National Bureau of Standards. That's the current distinctive mark regulation of 2019, and which in effect made certification mandatory. Previously, certification was voluntary, so anyone who wanted their product certified, they would seek for the service from UNBS. Now, effective 2019, it's actually mandatory. However, because of the big lag in terms of the market of many uncertified products, we are not able to cover that in a very short time. So we gave some timelines for most of the industries to be able to comply to the requirements, and we have been progressively undertaking this to ensure that everyone is able to comply. But as we give that leeway, there are sectors that we do not compromise, most especially those that deal with the infants and young children. So regardless of the voluntary nature of certification, earlier it was not possible to develop and produce products that were for infants and young children in Uganda unless they were actually certified. So that's the first line of enforcement that we do. But because majority of the products are also heavily imported, and you will agree with me that there's a very big number of products that are heavily imported, most especially the infant formulas, those go through what is called the pre-export verification of conformity. And if the product is produced in France, it's produced in India, it's produced in whichever part of the world, it must comply to the Uganda standards before it's actually shipped into the country. And as we were speaking, I was actually looking at in our system on some of the, because Barbara raised the issue of labeling, I went into the system to check to see how most of the industry is actually complying with the labeling requirements. And there were some violations, but a very big number of them actually comply to exactly what the labeling requirements are in the applicable Uganda standards, in terms of the cautions, in terms of not providing pictorial, in terms of nutrition labeling to provide the information that is necessary when someone has formulated the feed, in terms of instructions for use. All that is actually heavily input there, most especially for the imported products. They tend to comply easily because it's a little bit stringent in terms of the products that are coming in. I appreciate that we still have a problem with the local market, and I wouldn't take away from that. We know that there is that challenge. We did a study in 2017 and identified that 54% of the products on the Ugandan market are actually substandard. And labeling is one of the requirements that we need to have for products to be labeled as standard. And the trend that took was that majority of the 54% were actually locally produced products and not necessarily imported products. So we are starting to reinforce now in terms of our surveillance activities. And you might have noted probably in the last 2 or so years, UNBS has expanded significantly in terms of the surveillance activities and monitoring to ensure that everyone is able to comply. But to cap it all, that UNBS is here to serve. We are happy to get specific input in terms of where we need to have the interventions. We will be happy to share that the report that Barbara has highlighted this morning in terms of the specifics. We will be glad to get those details and probably follow up individually with the specific industries or clients of ours. I was chatting with that during the break tea, and I indicated that whenever we get those, because our certification is under our control, we are able to actually influence and ensure that the labels that are presented before us, before we certify any product, meet all the requirements of the current Uganda standards. So essentially that's what we are able to do, and that's not to say that we also do testing. So on the safety side, the quality side of most of these products, we have a fully fledged food safety laboratory, which is probably one of the biggest laboratories now in probably East Africa, a food safety laboratory, and we're able to do a full range of all the testing of these products and to assure that the quality and safety is guaranteed. So in a nutshell, that's what I should be able to present at this moment. Thank you.
Thank you very much, Hakim Mufumbiro. Colleagues, you may appreciate Hakim has really enumerated a number of things, but very keen, eye-catching, of course. Their capacity is growing, but there's a big problem of 54% of products in Uganda not meeting the standard according to the 2017 study. And there are a number of challenges he has raised. These things, most of these products are imported. We could be having different angles to standards in different countries, but they have met the minimum, at least according to him, among others. So, ladies and gentlemen, you have noted what Hakim has said. We shall come back to him, and if you have questions for him, prepare them. Shortly after the round, we shall come to you. And even online. So Gaston, the online community, those questions, please, let's have them for the panelists. Let me go to my colleague on the right, Gerard, from the Hunger Project and the Right to Grow Secretariat. Gerard, clearly a lot of very interesting issues here on the rights of the child. Clearly, we know Uganda is a party to the Convention on the Rights of the Child, since we signed it in 1990. And we know very clearly that the right to grow is along that line. But when you hear the statements of the issues emerging from the presentation today, that there are challenges in the child's access to their adequate food, which is breast milk, and there are all these constraints that we have heard about. But the voice of civil society has not been heard. Yes, Barbara is our civil society person, but it seems other civil society are not actively in that area, if I'm to use that word. Maybe it's my own view. What is your take on this issue, which seems to be very urgent at the foundation of the right of the infant to adequate food? Bwana Gerard, I think you can switch on the mic.
Thank you very much, Dr. Rukundo. From the Right to Grow program perspective, we are very honored to be part of the Nutrition Society of Uganda, and more specifically to be associated with this symposium. Looking at Uganda as a country, looking at the levels of malnutrition, especially among children under 5, it gives you an impression if we are still the food basket. You know, even the districts which ideally are known to be good at producing food, you'll find high levels of stunting. Even households of whom you regard as middle families or middle income families, working class, the elites, you get shocked having children who are malnourished. So first we think issues of access to food, especially to children, we must treat it as a human rights issue. I like the presentation that Barbara made. Breast milk is a natural thing. We don't want to be seen going against the rules of nature. When a mother, you begin denying your infant child access to breast milk, you are actually directly abusing that child's right to adequate food. At that point, as an infant, the best nutritious food they can ever get at that point is breast milk. And the organizers of this event, I want to really thank you very much for bringing up on this conversation a number of stakeholders, including UNBS. And one would ask, how is the issues of regulation, issues of safety being done? I'm happy Hakim mentioned a couple of commitments that government agencies like UNBS are doing, but still the problem is still very common. Maybe we may need to really broaden further this discussion to even involve private sector actors who are involved in this. And maybe we'll hear their side. Because for us, even as Right to Grow, we want to really bring in all actors, government, civil society, even all other food systems actors, including private sector, into this discussion, and we collectively find out what is the problem and what can we do together to make sure that we address issues of malnutrition, especially among children under 5 years. Thank you.
Thank you so much, Gerard, my brother, for bringing out those issues. Food systems, indeed, it's a big debate, and I'm very glad the Office of the Prime Minister is here because we shall hear from them that actually Uganda is ready and prepared to join the rest of the world on September 23rd on the Food Systems Summit. So I'm sure my brother Charles will give us some insights when we come to his time of remarks. Clearly, civil society, as you said, we can do more to support this agenda, but also to broaden it, as you have said. Ladies and gentlemen, on my immediate left is Dr. Richard Kajura, and some of us who have been engaging with him recently is that he's part of the core research group at the Makerere University School of Public Health, who have been dissecting or understanding deeply the issue of the enablers and barriers to nutrition, both in terms of practices and outcomes. And Richard, clearly from the discussion today, you can hear a number of issues. From your study, you have highlighted barriers and enablers to stunting. And one would therefore wish to know, from the academic point of view, how do you contextualize this debate of breastfeeding? Do we see it increasingly becoming a challenge? Are we doing well? Or how is it driving the malnutrition? And what key lessons, perhaps, would members of the society be interested in, even taking research further in terms of solving those challenges? Yes, Bwana Richard.
Yeah, thank you very much, Dr. Peter, and the members and those online. This is very interesting, and I just want to applaud my sister Barbara and Elizabeth for articulating real issues. As academia, and our mandate, as you are aware, is research, training, and outreach. What has actually come out here on the component of implementation and monitoring, you would actually, one aspect that comes out that seemingly at the health facilities, they are like have a small idea, but behind the curtain, it looks like they are not document. The document we are looking at, the code, is likely not to be at the health facility. And this talks volumes. When you hear that the health workers are being talked to, imply they don't have a reference document within them. And that one would point the ministry need to do something to provide these documents to the health workers so that they are informed and they have a reference. My interaction with the communities is not any different because they lack knowledge. They lack knowledge, and any person that talks to them to interface or to allude to the health of their children or survival of their children, they uptake. Ladies and gentlemen, you agree with us, and because we interact with these ladies and both our colleagues at the workplace and the community themselves. The cardinal aim of the mothers is to have a live child. That's the objective. So any person that comes to the mother is likely to take it all. But what do the industries or the people who are enticing mothers to get to these substitutes. They undergo what is called aggressive advancement. It's aggressive. And the terms of reference is very clear, is that their term of reference to make profit. Like, it's very clear. So what does it mean to us and in the academia? Is like, we need to first of all provide evidence-based information that the statistics that we are seeing could be as a result of this aggressive advancement. And if that is said, then we likely need now to go in with counteracting messages to the community. And what we're doing, as Dr. Rukundo indicated in one of the work we are involved in the exemplar, we have noted that we need to take public health to the households. We have actually been a long time, we have actually been at health facilities, but we need to go to the communities. You listened in when Dr. Kiboneka indicated that when at the health facility things seem to be being done very well to a proportion, but when it comes to mothers getting back to the communities, the things or the effort that actually done get tarnished. So we need actually to get the communities need to be educated so that by the time they come to health facilities, since at this point we have most of the mothers delivering at health facilities, a big proportion, they're informed so that they are not bombarded aggressively by a marketer. Even if I was the one, I would actually go in, but they just need to be informed. But also what is coming out clear, I just looked at Article 1 of the code. It's very clear that both breastfeeding, which we are us advocating out for, and the substitutes, they're all serving one golden goal. They want to save the child. And so I think there is a need to both parties to talk because the goal is the same. And as Barbara indicated, it is the practice of marketing, which is aggressive, that we need to make sure that it's done right. And we will actually get what we need. I think the other aspects, I think what came out clearly is capacity. I think we need to put the capacity across all boards. We do the training, we're training our students into this. But the aspects, I think we need to develop a number of research around here. We need to get our students, get on this. I would be interested, I think there's one, as Professor Kiboneka was finishing our slide, there's a chart, a conceptual framework of optimal feeding that she showed. It was very clear that one will actually want to understand the factors that could be responsible to this, and this, so that we tease out, because there are a number of factors that could be responsible, but we cannot do everything at the time. But if we tease out which are the drivers, which are the facilitators in this aspect, it will serve all of us going forward. Thank you very much.
Thank you very much, Dr. Richard. Members, I hope you are really following the discussion. Our friends online, this debate is quite interesting now. Dr. Kajura has outlined that there's need for a win-win, but there's a problem of awareness. Many people are not aware about these things. Even the health worker we are talking about, some of them are not aware. And Dr. Richard also talks about the problem of capacity, that many people lack the capacity. There are many SMEs coming up in this country. MSMEs, micro, small, medium enterprises. And now there's agro-industrialization. And Barbara, perhaps that's where the question comes. Given these debates now, given the fact that, as Richard says, there's lack of awareness, I remember very well, Barbara, one of the issues which sparked this dialogue was even that our own Makerere was against the code. Of course, you have been silent, me have said it. That this place where we are, people were against the code. The innovators of the science were against the code. because they are putting some pictures. And again, it comes to the point of awareness. But because some of us may be researchers, we're interested in putting out information, and then we bring this fancy child and etc. on our product, not knowing that actually we are violating the code. But also, Barbara, there's a dilemma here that the country is promoting industrialization. And there was one minister, a former minister who passed on, rest in peace, the Ministry of Health, who went to launch one of the companies. I remember we had a debate. And again, it came to lack of awareness and coordination and etc. So in your view, given the violations that you have shown are massive, if we'd use that word, or extensive, like you have said, and given the fact that Richard is alluding to a problem of awareness, the need to take the message to the community, to the household, and also the fact that the private sector is being encouraged, but without clear guidance on this code. How do we move forward? Do we need to have a massive campaign? Has the ministry failed on that? What is the best way forward to make sure really people are made aware so that we do the right things and we are all on the same page? Thank you.
Well, thank you very much, Dr. Rukundo. Actually, last week we were training some doctors and midwives in Kampala regarding the baby-friendly health facility initiative. And after I'd finished the talk, the room was cold. Sorry. The room was cold. Why? Almost all of them were unaware of the code. So I concur with everyone. We need to take this campaign to the next level. And I believe Nutrition Society is well placed to start this campaign. That's all I think.
Barbara, I thought you were adding on. So Barbara has said that there is need for the campaign. So, ladies and gentlemen, now we are opening the floor. I think Barbara was so brief. She knows many questions are coming that side. So, yes, Dr. Gaston, I think you have a question to make. Okay, please. Members, Dr. Gaston has some he's taking from the online discussion. So, Doctor.
Thank you, dear panelists, representatives of government agencies, and the rest of the members, and the media. Thank you for turning out big. It seems you are like half of the audience here. So thank you for the good mobilization. There are several questions coming in, and what we are going to do, we are going to give, because our time is almost up, the one representing OPM is already here, and we need to have that and then close. The first query, someone is saying that the audience, the way they see the audience, it is largely of nutritionists, food scientists, and other technical people. What about private sector and hospitals? How do they come in? That are we moving along? Now, this is the first one of a series of meetings we shall have. And this one was actually largely targeted at nutritionists. But in due course, inshallah, we shall have more, targeting different groups, all those other groups. In fact, as you are informed, we had actually invited one of our members who is actually a marketeer or a dealer of a milk substitute to tell us exactly as a nutritionist, how does he put all these things came in actually at the last minute, so, but we hope in due course we shall be able also to engage them in a different forum, which is not specifically for breastfeeding. And I think that one should go to, unfortunately, I don't know whether somebody is still online, or Lola, or any other person from the ministry, those who are online. The question is, we are implementing all these regulations to do with the code in public health facilities. But according to the observation, this is not happening in private health facilities. So what is the ministry planning to do? Anyone from the ministry, or Barbara, if there is something you know, you can quickly talk about that. Those who are online, is Laura present? So in Yugosif, yes, Solomon. So can we have Laura say something?
Regarding what the government is doing to target a private other than the government health facilities. So like you've heard previously, we are rolling out what we call baby-friendly health facility initiative. And here, in doing this, the initiative, we are not only looking at public health facilities, but we'll be targeting all the health facilities in the country that are providing maternity services. So we are looking at about over 1,200 health facilities, and that would include both the government, the private, the PNFPs, and the private health facilities. So yes, we are doing something, and this time we are not only going to be in health facilities that are government supported, but to look out to reach every other facility that provides baby-friendly facility that does maternity services. I hope I have answered. Over to you, Gaston.
And the next one is yours as well. You stay online. Someone has observed that, in fact, in most cases, and especially even in big hospitals, when the children are born, there is a practice of giving them warm water for even up to 2 days, as the mothers are covering. So what do you have to say about that? Isn't that a violation of the code as well?
Apart from breast milk, and we have seen that as soon as the baby is born, then they're initiated on breastfeeding to benefit from that very first milk, what we call the colostrum. So yes, it's a violation, it is a bad practice that may be happening, and that I would attribute that to lack of knowledge. Or Dr. Kajura has already talked about the need to have the capacities of these healthcare providers developed on the key packages. So yes, I think if we are able to scale up the BFHI, the Baby-Friendly Health Facility Initiative, and we are able to reach all the health facilities and majority of the healthcare providers, such practices should be done with and addressed. Over to you, Gaston.
You can also comment on the next one before you leave. Somebody else has also observed that healthcare, it's a question, how will healthcare workers get information about breast milk substitutes access health workers and talk to them, tell them what is included in their products and all that? How would they know about these products so that they're able to advise whoever would like to use them? Thank you. Thank you.
Okay, thank you, Gaston. So I really appreciate the questions that are coming through, and of course, the gap is still big in terms of disseminating this information around the code and the other nutrition packages that actually promote the code. However, so I think moving forward, we need to work together, all of us, to ensure that we do such meetings like the one we are having now, but also, like I mentioned, we have integrated the main issues around the code in many of the packages that we are delivering through the health facilities. So we have what we call MyCAN, which is maternal, infant, young child, and adolescent nutrition. Those are guidelines that benefit the healthcare providers at different levels. We have a package for the community, we have a package for the health facility health workers. And in all these, we have ensured that the issues around the code, the issues around the BFHI are well incorporated and integrated. So when we go out to do the trainings or to disseminate these packages, we are sure that we'll be able to reach. We may not reach everyone, but we intend to reach majority of the healthcare providers with these packages and with these key messages around the code and its regulation. But of course, we also have national every year in the month of August, and during that time we intensify information giving dissemination around the code, around breastfeeding. So we'll use the different platforms that exist, targeted and in general, to create awareness on the code and create awareness on breastfeeding. Over to you, Justin.
Laura, for that good explanation. I hope the members have appreciated these issues. Now, the next one is for Bwana Hakim from Bureau, UNBS. The audience would like to know what you are doing, because they are saying costs of certification are very high. So what is UNBS doing to ensure that small-scale food companies are able to certify their products? Thank you.
Yes, thank you very much. I think the question is timely because UNBS has recently, in less than 2 months ago, at the beginning of this financial year, reduced the cost of certification to essentially help the micro, small, and medium enterprises be able to meet the requirements. So initially, where someone was, for example, paying $1 million shillings for some of the requirements to be done, that has been halved or put in half, up to 500,000. So the consideration that micro, small, and medium enterprises should be able to meet certification requirements has been incorporated in the new fees structure. Additionally, we have a fully fledged MSME desk in UNBS that provides constant services in terms of training, in terms of awareness activities regarding most of the value chains, and we have these sessions. We used to have them physically, now we have them online, to prepare most of the industries to get certified, because over time many of them have felt that this is for the big players in the market, yet certification is really about meeting the requirements. It doesn't matter about the size of the facility. So long as you put in place the basic hygiene and good manufacturing practices, you should be able to get certified. So we have made those changes, and to, of course, as well, take into consideration the effects of the COVID-19 that has placed on many of the businesses. Thank you.
Thank you, Hakim. The last one from me, this was raised by Daisy Atengo and Mobaje Muhammad. now they would like to, Barbara to indicate that complementary foods, all these cereal-based foods we see around, winning foods, are they also among the products you are talking about as breast milk substitutes?
Yes, anything that displaces breast milk is a breast milk substitute. Thank you.
To clear the air, there are some people who think that this code covers foods during that period when exclusive breastfeeding is expected. So, beyond the exclusive breastfeeding period of 0 to 6 months, how far do we go?
As I told you, it's as far as the code is concerned, up to 3 years. We are not supposed to promote anything up to 3 years. So, I'm hoping I'm clear.
That's okay. If there are any further questions, that's fine.
Thank you. There is a microphone, and okay, there are 3. We are going to move from here. That will assist here, then towards that side. So please, yes, be brief, specific. The next side will have now it's on.
Thank you so much for the wonderful discussion. My question goes to Barbara. Barbara, I would like to know, yes, it's not that I disagree with the code, but I want to know what happens to the babies whose mothers pass on immediately after birth, or maybe the mothers have issues like breast cancer and they are unable to breastfeed. How do they access such products if they are not advertised or if they are not marketed? How do they get the information about these products? That's my question. But also I would like to support the campaign that you earlier hinted about, because we have been engaging with some women in local communities, and they brought out the issue of weaning their babies when they are like even not yet 6 months. And I think it is just because they are not aware of the benefits of breast milk. Thank you so much.
Thank you. We shall have the answers after, in the interest of time.
Yes, thank you so much, panelists, for the presentation. My name is Peterson Kato Chikomeko. And now, sometimes I get to think that we talk of awareness, and people not being aware. But to an extent, I think there is an appreciable level of awareness in the community. People know. I believe a big percentage of people or mothers know that it's important to breastfeed. But then the environment we are working in is not equally supportive. For instance, if we think about maternity leave in both public and private, if you are saying mothers to exclusive breastfeed for 6 months, are they allowed to stay home and exclusively breastfeed for the 6 months? They are not. Do we have breastfeeding corners? So basically that whole environment is also another very big limiting factor to exclusive breastfeeding. And because of that, mothers have to find alternatives. So, and some of the major alternatives are now the BMS, the substitutes. So I think when we are talking about this code, we should also talk about the supportive environment. How do we support mothers to exclusively breastfeed? However much we talk about these violations, if the environment is not supportive, the BMS substitutes will continue. That's my view. Thank you.
Thank you. Good enough. We have the Office of the Prime Minister here. As they prepare to close, I'm sure they will give us some hints on what we are doing.
Thank you very much, the presenters, the moderator for this day, and the organizers of this event. My name is Brian Sekasamba. To make the record very clear, I saw even my former lecturer failed to introduce me clearly. And I realized there was a bit of stigmatization when it comes to the promotion of infant formula. So I take care of health and nutrition in Int'nal Nutrition. So I lead the team that markets and promotes infant formula in Uganda and Rwanda. And I wanted to make it, I want to be very clear that as Danone, we support, encourage, and disseminate information in regard to breastfeeding. Breastfeeding is the best, it is the gold standard. It is an equal feed for optimal growth and development of our babies. That is in no doubt. And actually, as we go out with our work, we encourage and educate healthcare professionals to try as much as possible to breastfeed these babies. I saw my mentor, Barbara, she might not remember, but she trained me some 10 years ago on breastfeeding in Int'nal. I think it was that famous hotel, Minister's Village Hotel. Even at the Commissioner Minister of Health online, I believe she's watching. They have mentored me in regard to infant and young child feeding practices. I find it quite so appalling that we cannot have a debate because the center, as manufacturers of this infant formula, we are on the spot of this discussion tonight. UNBS has engaged us on several platforms when it comes to standard, labeling, and so many other things. So why not actually, when you're in school, the very hard boys were given responsibilities to be prefects so that they can watch out those that are violating. Even in soccer, you see the players putting up their hand to show the referee that there is a violation here. Okay? So I invite IBFAN to work with us closely. We know how breastfeeding is very important for our babies. But in case you're not able to breastfeed, what would be the suitable option? And Article 1 of the code is very clear. Appropriate promotion of breast milk substitutes. I know at one point, as marketers, we could be aggressive. That is why IBFAN and the Minister of Health have to come in to check if you're regulating the temperature. We are the guys who have the temperature. If it goes high, call me and tell me, Brian, I think the temperature is very high. You are aggressively marketing. You're unethical in regards to this. But if we are codenamed enemies, you know, and also we are sneaking into the healthcare facilities, I think that that language is actually not very good. Lastly, as I conclude, I believe the framers of this code, as you've heard the history, thought in their wisdom that the healthcare professionals can make right decisions when it comes to infant and young child feeding. That is why they left a gap that don't talk to the public. But in case you have scientific and factual information in regards to your product, you can reach out to Dr. Rukundo, who can now do an assessment. Is the product feasible? Is it safe? Does it have the nutritive value that is required for the baby who is not able to breastfeed, so that the doctor can recommend? But from this discussion, I think we are casting a doubt on the capacity and credibility of our healthcare professionals to make decisions in regards to infants and young child feeding. But I've not lost hope. I believe we'll have an opportunity organized by NSU to have this debate, and I engage the Minister of Health, IBFAN, and other stakeholders when it comes to marketing of breast milk substitutes. I thank you.
Thank you very much. And appreciate your submission. We had Dr. Hedwig first this side, and then Charles is really asking us to close. We shall have one more from this side. If there are any others There was Dr. Hedwig there. And then we proceed and we come back to the high table, we wind up. We have Charles coming in to close, and then we go for a group photo and lunch as we depart. Oh, yes, thank you.
Thank you, moderator. This is a very interesting discussion, and I have only 2 questions. Good. One, I think I need clarity first from Barbara. She says breast milk substitutes can go up to 3 years of age. As nutritionists, we know that after 6 months, breast milk is not enough. There's a gap, and we need to start complementary foods. From a submission, looks like we have to suspend all those complementary foods to only give breast milk to 3 years of age. I just need clarity on that, how we differentiate between a breast milk substitute and a complementary food. 2, from the submission, it was very clear that engagement between promoters of breast milk substitutes with the healthcare provider should be factual and scientific. But also in the same code, she said that the representatives of these companies should not come to the healthcare, the system, the facilities and all relationship. And my question is, if they need to be scientific and factual, where should the representative of this breast milk substitute meet the healthcare providers? Thank you.
Thank you very much for that very key and precise questions regarding the 3 years, and also regarding where do we get the healthcare providers to give them information. Any other in the audience? Any other online who wants to ask a burning question? Gaston, if there is online? No one? Okay. Ladies and gentlemen, thank you very much for the questions. Allow me to come back to the high table. As we started, Hakim, any other final point you want to make as we wind up?
No, I think in terms of effective regulation of this sector, and I noted the Assistant Commissioner indicated that the current regulations are under review. It should be interesting to note what exactly is actually changing. What was the shortcoming in the previous regulation that is actually changing now that we are going to find solutions, because ultimately most of the issues that relate to effective regulation of aspects in this sector are really present in the market. It's not about the products themselves or related issues, but it's about issues in the market, advertising, marketing, and that leads me to the last question of the absence of a modern food safety law in Uganda. If we continue with that approach, we are likely going to be speaking a lot of things, but not really having good value in terms of effective food control systems and management in the country. So we have an archaic law of 1959. I'm not sure if anyone was born by that time in this room. It's not responding to the current developments, the current emerging issues that we have, and this sector is not really spared. And the Food and Drugs Act is very categorical and clear about issues of advertisement. But by the mere fact that it has remained archaic and very old, it's not really, the legal framework is not really supportive. So we may be doing so many statutory instruments, so many regulations. The moment we don't touch the real thing, we are not probably providing a robust solution. So I thought that should actually be going into there in terms of our contribution to ensuring advocacy, and I had many of us are advocates here to ensure that that process gets completed. Our colleagues from the NDA probably should have been here to give us a brief on where they are and what needs to be done to complete that process. Thank you.
Thank you, Hakim. Gerard, policy and legal framework advocacy. Where do we head to?
Yes, thank you very much, panelists and all other people have given in their comments. From a right to grow perspective, really, the issue of focus here is that we have a duty and responsibility as people to ensure that all children reach their full potential, but also to ensure that we don't have stunting and malnutrition among children below 5 years, but also to provide a situation or an environment where children have access to exclusive breastfeeding. But also, having said that, we also want to really broaden this discussion and involve in other stakeholders, including the private sector actors. And that's why I also want to say it's very important to provide chances to people like Brian to hear them out. Thank you very much.
Thank you. Indeed, Brian is from the private sector. Like I introduced him, I was very careful with my words. So yes, Richard, how do we move forward the research agenda?
Thank you very much. I think what is needed going forward is to have a strategy. We need to have a framework, a strategic framework for all the stakeholders for us to zoom in as academia to do implementation research. We want actually to observe as things goes on, and so as we can guide and provide some of this information, as I said earlier, so that the Minister of all the parties, Minister of Health, the civil society, and the beneficiaries should actually benefit to this. And why we just want to have a coexistence, we need to have a marriage that all the people who are contributing to the lives of the children should be sitting on the same table and discussing, and to be open that what is not, where things are not going wrong, we should actually be open. And most importantly, the other aspect for all this, we will need to coerce the policymakers to provide an enabling environment. And lastly, I think this is maybe I'll need to request Charles to talk about it. It's the behavioral change aspect and the strategy that we need to learn. And the most importantly, in our research and implementation aspect, we will need to do, like Barbara was alluding to do the integration, because so that this is not a standalone activity, to be integrated within the running health system framework. Thank you very much.
Thank you, Richard. Barbara, clearly the Minister of Health could be saying the marketing issue is an issue of trade, maybe. Have we not engaged trade people, perhaps? And given the other questions, how do we make sure these private sector people do the right thing and we live with them?
Yeah, thank you very much. The 1997 regulations provide for Ministry of Trade to be part of the working group. Actually, it's a committee on infant and young child feeding, specifically focusing on the code. And these are the people who should work hand in hand with Brian to be able to get his concern and bring it to the working group. In case Brian wants to talk, for example, sorry, Brian is representing, yeah, sorry, I didn't want to. You are representing other members. In case you want to talk to the health workers, you have to go through that committee so that there is no conflict of interest or even misinformation, something like that. It will be so open, and we shall know that, yes, these people came and they talked to Ministry of Health under the guidance of Ministry of Health. But for us as IPFAN, we have a principle of we not engage the infant food manufacturers. So if at all this meeting, the infant food manufacturer had been on, you hear everywhere in the world saying, Barbara, what did you do to us? Yeah? So it is a principle that I didn't want to I don't know how, compromise. It's not actually a compromise to do something that later on they say, you know what, this is our principle and you have gone against it. But having said that, the lady there asked about those children who don't breastfeed and their mothers are sick. Here we are saying breast milk substitutes have to be available. They are available. And the healthcare provider who prescribes, yeah, based on the situation in her. We don't refuse the availability. We don't talk about it. The issue that we talk about here is the promotion and advertisement. Is that clear? Don't misquote us. A mother, if she has opted to breastfeed, she should be supported. But it's going to be one-on-one, eh? Not everywhere in antenatal and you're talking to everybody. That is what it is. The other issue of somebody brought about the workplace. Yes, there are regulations that are coming in actually, and in the next 2 or 3 weeks, there will be a consultative meeting to everyone regarding the regulations breastfeeding at workplace, where there will be rooms. If a mother doesn't want to bring the child to that room, there are breastfeeding breaks. There should be a policy on breastfeeding at all workplaces. There should be a facility for expression of breast milk at the workplace, all workplaces. And then also information about breastfeeding in such workplaces. So Ministry of Gender is taking care of it, and I can assure you by the end of this year we shall have the regulations in place. The other issue of breast milk substitutes, 3 years. You remember from 6 months the child has to continue breastfeeding up to 2 years and beyond. So that breastfeeding period is what we are talking, the breastfeeding during that period is what we are talking of. But we do not refuse complementary foods to be available. It's about the marketing. Putting these nice babies on the packets, please, let's not do that. Let's put the age on those packets. Let's do the labeling very well. There we shall not have any challenges. I hope it's clear. Then the factual and scientific, that's one we talked about. The committee should ideally do that, and I pray the Minister of Health is going to talk about it. If not, it's something that also we feel for the infant food manufacturers when it comes to how will this information get to the mother. But ideally, they should do it in a transparent manner. We don't expect you to go to the health facility and start talking, then again after that you go behind and talk to the mothers, and yet you are supposed to meet this particular person. So get permission from Ministry of Health, you go and do what is expected of you, in case they give you that permission, and then thereafter, things will move right. Yes, there's room for improvement. Hakim talked about the gaps in the, why are they being revised, Hakim? Yeah. You saw that table, I saw the labels being read, the area of information. And then there was also another area. But also the World Health Assembly resolutions, Hakim, as you know, since 1997, there have been every 2 years, World Health Assembly has been passing resolutions regarding infant and young child feeding. So we need to look at all those resolutions and include them in the updated regulations. Thank you very much.
Okay, ladies and gentlemen, an applause for the team at the high table as I request them to once again take their seats. I thank you very much, colleagues, for those very wonderful submissions, for the knowledge you have shared with us, and the guidance you've given, including even the feedback you've provided to the team here and online. For the team online, thank you very much for being with us. We are now heading to the closing remark of this meeting. We are very privileged and honored to be with a member from the Office of the Prime Minister, a senior nutritionist there, who's going to really take us through the closing. So, ladies and gentlemen, at this point in time, allow me to invite my brother, my senior colleague, Charles Asimwe, from the Office of the Prime Minister, to come and share with us the closing remarks on behalf of the Commissioner, who was not able to join us. Ladies and gentlemen, Charles Asimwe, many of you may not know him, but I'm sure many of you know him also, has been a nutritionist for several years. I think more than 15 years, he will tell us. He has worked in various capacities, and at the moment, he's our senior member, if I would use that word, of the society at the office of the Prime Minister. They are doing a lot of things in terms of coordinating nutrition activities. And indeed, we are proud to say that this is one such activity which requires a multi-sectoral approach. Because we have been hearing things about trade. Marketing is not for Ministry of Health. So Ministry of Health gets constrained. The issues of trade here, the community, Ministry of Gender, Barbara told us some guidelines are coming from Ministry of Gender. Yet we had thought this is a health issue. So we are saying breastfeeding and indeed nutrition are multi-sectoral issues. And if you recall, I think it was October 4th or 10th, the President announced that nutrition would be coordinated by the Office of the Prime Minister. So, ladies and gentlemen, it is my honor and privilege, therefore, to invite Charles Asimwe to address this meeting and also officially close this workshop. Charles, maybe the high table is better for you.
Thank you, the Master of Ceremonies, protocol observed because I see time is going. And we have another meeting at 2, so I have to be very fast. Ladies and gentlemen, I thank you very much for coming to this function. And I will start by mentioning that on the 21st of February 2019, we gathered here as the Nutrition Society, and we are here again to discuss the progress of implementation of the breast milk substitute marketing. I am Charles Asimwe. I work for the Prime Minister as a Senior Nutrition Advisor, Uganda Nutrition Action Plan Implementation Coordination. So, as you are all aware, in 2011, the government approved the first Uganda Nutrition Action Plan as the country's strategic framework for scaling up nutrition in Uganda. And that one was in response to the Scaling Up Nutrition Movement Global, which was initiated in 2010. Over the years, government has been implementing the multi-sector action plan for nutrition, and you are all aware that one of the interventions that action plan was promotion of infant and young child feeding practices, and we shall note that over the time, the rate of progress, although the figures for prevalence of exclusive breastfeeding have been increasing, but the rate of increment is not as expected. When you look at the World Health Assembly targets, yes, we are there by the figures we have. When you look inside the practices, you can mention what Barbara was mentioning. We might be having a high figure of exclusive breastfeeding at 66%, but what happens inside that process before you reach the 6 months leaves a lot to be desired. And therefore, it is important that we create an enabling environment for promoting, supporting, and protecting exclusive breastfeeding. I will use one quotation from the Bible, which is a behavior change quotation. Those who are Anglicans, there is a message that they know what to do, but they are left what to do what is supposed to be done, and they are doing what is not expected to be done, and therefore in them there is nothing good. So, I agree with Dr. Peter. People are aware of what to do, but they are not doing it. And you will note that a simple observation mentioned that the educated, the very rich, people with PhDs, master's degrees, who are mothers and fathers, are the ones violating the breastfeeding practices. Most of them are even nutritionists. So the issue of behavior change is important to believe in what you are promoting. You might be talking about good breastfeeding practices when at your home you are hiding, giving the what? The substitutes. So we need to check our hearts and do what we are preaching so that we can have improved nutrition outcomes. Regarding the process of implementation of UNAP 2, I want to mention to you that the government on 22nd September approved the second Uganda Nutrition Action Plan. It has 18 strategies, and out of the 18, one of the major strategy, which requires a total cost of 1.7 trillion Uganda shillings, is the implementation of the maternal, infant, and young child feeding and adolescent nutrition, which is led by Ministry of Health. So as we are here mobilizing for promoting breastfeeding, let us also ensure that we mobilize enough resources in terms of human beings and finances for implementation of that area. I want to thank Minister of Health for having moved ahead to approve the action plan for MyCan, and I hope in the next 5 years, the UNAP targets will be achieved if we remove these barriers of behaviors. Also related to that, the action plan has a monitoring and evaluation plan. For the first time, colleagues, the action plan has been developed with a monitoring and evaluation framework which allocates indicators per MDA. As you are aware, we have moved from sector to ministries, departments, and agencies. So each MDA has a number of indicators which are supposed to be monitored, and therefore the relevant interventions. And the role of OPM is to handle the coordination issues along implementation. I want to clear that to make sure that we know that the role of OPM is coordination of implementation of the issues, not actual implementation. Also, as you are aware, in 2015, when the UNAP 1 was almost ending, that's when we were developing the communication strategy for the UNAP 1. Just 1 year to go, we are developing the strategy. So this time what we have done is to develop the national advocacy and communication strategy that is in tandem with the UNAP 2. And very soon, we shall organize national launch for those 3 documents, the action plan, the meal plan, and the advocacy and communication strategy. And the action approach is we are going to use the regional-based approach of implementation. If we are discussing issues of breastfeeding and marketing of breast milk substitutes, it is better we go to sub-regions. We have 15 sub-regions, and then we have issues handled sub-region by sub-region. We might be here for the whole country, but the issues are different based on where you are. Then I will also mention to you that we expect the following to be done, and that one I read verbatim from the Commissioner's message. So this is the Commissioner's message, which I'm reading the way it is. If the phone gets off, then I will just... I take this opportunity to preside over this symposium where the Mission Society in Uganda is discussing the progress of implementation of the International Code of Marketing Breast Milk Services in Uganda. As you are all aware, nutrition issues are multi-sector, and in light of this, government through the Uganda National Action Plan vested coordination implementation of action plan of activities in the office of the Prime Minister, specifically in the Directorate of Strategic Coordination and Implementation. Actual implementation of the actions, including breastfeeding, is a mandate of ministries, departments, and agencies of government and local governments supported by non-state actors. I want to mention to you, as the MC has mentioned, that most of the actions I've been talking about, although we have been pushing Ministry of Office to answer, but some of the answers are supposed to be from other actors, especially from Ministry of Trade, and also from Ministry of Gender. In September 2020, government approved the second action plan, and this will be the country's strategic framework for scaling up nutrition in the 5 years when we are implementing the third nutrition action, the third national development plan. And you need to note that in the third development plan, breastfeeding issues have been clearly included under a program called Human Capital Development, and even the indicators and some costs have been included there. So I encourage the actors to look through the development plan and also identify what are those actions that are being proposed for implementation in support of breastfeeding. It is recommended that all children should be put on the breast within 1 hour, and that feeding of newborns should be only on the mother's breast milk. I want to thank Barbara for mentioning that statement. The statement you started with, I would be happy if you can broadcast it across the whole country, but touching the actual actors, especially at the implementation level, the health workers, the business actors in the private sector, and of course engagement, because we believe that nutrition is by engagement, not by harassment. I have noted there is an element of don't come near me, but you might continuously pushing those away who are selling the breast milk substance, and they actually take over most of the work because we are not giving them space for it. If IBFAN cannot engage with them, let other people who cannot be blocked by the principle of engagement discuss with them and we see how they can follow the right things. In addition, we are saying that what is paining us is that the biggest number of children who are getting pre-lactal feeds are actually from urban areas and from the educated. Isn't that one a paradox? Why are we in school? Our mothers breastfed us. Actually, for us, I come from Kanungu in Chigezi. If they want to abuse you very well and you feel the pain, they will say, no wonder you look like you are not breastfed by your what? By your mother. That's a very big insult. So why are we refusing our children to be breastfed by having excuses? So, you will note that 34% of the children in Uganda, therefore, are being given breast milk substitutes, and they are not actually getting the right breastfeeding practices in the first 6 months, and therefore the stunting issues come in. So we are saying we all have a responsibility for taking action and dialogue with each other. We are using dialogues, not confrontational approach. As we conclude, this is the message for the MDAs. 1, the responsibility of taking action on monitoring the implementation and enforcement of sanctions in the case of violations should be taken on especially by Ministry of Health, with support from Ministry of Trade, through the agency of UNBS. Let us implement all the steps to successful breastfeeding practices in Uganda. You note that we have over 6,000 health facilities in Uganda, and if we could reach out those facilities, especially the ones which have health center 3s, the 4s, and hospitals, and we communicate this message on direct contact with the actors, then we can make a difference. Let us address communication, education, and behavior change activities, especially by engaging the fathers in caring for their infants and young children. We are saying under UNAP 2, Ministry of Gender and Health are expected to develop standards and guidance for child care facilities at workplaces. This one is already available in the NDP 3. So it is important that the actors of Ministry of Health take on that. Instead of jumping to pick out others which are not already in the plan, let us prioritize those actions so that people can have an enabling environment. We are saying let us develop and implement employment regulations related to breastfeeding, especially the maternity and paternity leaves, and also enforcement of the, we can work with the people in the community department, the probation officers, and the labor officers, so that they can also provide an enabling environment for these mothers and the fathers to promote breastfeeding. Lastly, but not least, I call upon all of you to continue supporting the implementation of the International Code of Breast Milk Substitutes in Uganda to enable us to achieve the desired results of the NDP 3, the UNAP 2, and the Zero Hunger Strategy for Uganda in the period 2020-25 and 2030. With this, I take this opportunity to thank you for attending and remind you that the facilities in Uganda, 45% of the facilities in Uganda are government, while 55% are private, and therefore we need to engage more with the private and also government, otherwise we might lose the targets. I thank you very much for listening, and I've mentioned all this on behalf of the Commissioner, Strategic Coordination and Implementation of Government Programs and Policies, Office of the Prime Minister. I thank you.
Yes, thank you very much, Charles Asimwe from the Office of the Prime Minister. Ladies and gentlemen, this symposium has officially come to an end. On behalf of the Nutrition Society of Uganda and on my own behalf, I thank you sincerely for having been with us all this time. I thank the members online for having really stayed hooked on up to this far. I wish we could invite you online to join us for the lunch, but unfortunately the distance is a constraint. Nonetheless, we pray that the Almighty God keeps you well and safe all the time until we meet again next time. From here at the Command Center at Makerere University, we wish you well, and we invite our members in the audience to kindly step backwards for a group photo, and then we go for an sumptuous lunch that has been prepared by our Secretary General today as our host. Yes, and the one online group photo, yes, I think the one online's kindly show your video now so that there's a group photo by Secretariat. The ones online kindly show the video. Secretariat will be taking the photo. Otherwise, from me and the team here at the Secretariat in Makerere University School of Food Technology and Nutrition, we say bye-bye to you, and we thank you well. We wish you the best of good health and nutrition, and keep well, keep safe. Amen. Thank you.